Obviously, so many of us have dealt with skin cancer scares, me included in that. What can we do, first of all, to try and prevent getting skin cancer in the first place?
Well, two things. Obviously, sun protection, so using sunblock hats, staying under the sun is obviously, but people in Florida kind of ignore that a lot of times, but even myself, I hate to wear sunblock, especially men. So that's the primary thing, is prevention. So unfortunately, a lot of our older patients have been sunburned, and so 1 out of 5 Americans will be diagnosed with skin cancer at one point in the United States. And we treat almost 5 million people every year for skin cancer. So it's a huge number of patients we see. And it's a large amount of our dermatological and even plastic surgery practices is skin cancer. Basal cell cancer, as many people know, is the most common one, and fortunately it's the most benign one, and 2.8 million of those. And then squamous cell carcinoma is the second most common cancer, which is a little bit more aggressive. Again, about 2% of those patients will end up dying from that, but it's that means 98% of people do well. And melanoma, which we're really not going to touch on, but today is the most deadly one, and that is much more aggressive. But to answer your question, I think the second option, other than prevention, if you're 70 years old and you used to wear betadine and baby oil when you went in the sun,
right,
is early detection. So screening, I recommend most patients that I see to see a dermatologist at least once a year for skin screening, because a lot of my patients, by the time they come in, some of these pictures I have, I don't know if you can show them, but the lesions have been there for more than a year, and they ask them, why haven't you come in? Well, they kind of, it's called denial.
Yeah, they push it off, right?
So you have bleeding, crusting lesion on the nose for a year, 2 years, 3 years. By the time we excise it, you lose a large portion of your nose. It's very hard to reconstruct. So I always tell my patients, please, if you see anything suspicious more than maybe 6 weeks, to see a dermatologist right away and get an annual check, even with your family doctor. I see a lot of my family doctors also find these cancers. So it's really, really important to find these early, to get treated. There are non-surgical ways to treat these: freezing, burning, cauterizing, curetting, many ways of treating the small ones. So I tell my patients, if you go in and find them early, you don't even need surgery. Just scrape them, the dermatologist freeze them, and you're done. So, and we've been finding patients even in their teenage years from the sun tanning beds.
Wow.
So we've been seeing people in their 20s quite often now. So it's really important to know sun tanning beds, stay out of the sun, sunblock hats, and early detection.
All right, Dr. Kim, thank you so much. We appreciate it. You're watching MIC News This Morning on WXCW.